you're a baby, if you have a baby and your baby is 1 month or less and they have a fever, irregardless of whether the baby looks good or not, that fever needs to be checked out.
Hello and welcome everyone to Pediatrics To-Go, your go-to for pertinent pediatric information in our world today. Today we have Dr. Ekuase Sanusi in our midst, a board-certified pediatrician at Children Healthcare Atlanta and also the co-founder of Pediatric Partners Victoria Island, Lagos. And I'm Francisca Lename, your co-host and facilitator. And we're going to be talking about childhood fever. So on to you, Dr. Ekuase. What's childhood fever?
Thank you, Francisca. Now, what is a fever? A fever is when a child has a temperature of 38 degrees centigrade, which is equivalent to 100.4 degrees Fahrenheit. And patients ask me all the time, when is a fever dangerous? And the truth is, a fever is a number. Having a fever tells us the immune system is fighting something. So most times, if you do have a fever, you're sick, you have an infection. Most times it's a virus or a bacteria or malaria. And the number by itself is not the most important thing, it's what your child looks like. So if your child is bouncing all around the room, happy playing and just good to go but has a fever, then you want to treat the fever, but that's not something you should be anxious about. And if your child is really, really looking sick and the temperature is 38 degrees centigrade or less than 102.5, which is equivalent to 40 degrees centigrade, then you don't need to worry. But now the reason I bring up those numbers is because if the child has a fever and is 41 degrees centigrade, which is like 102.5 degrees Fahrenheit or higher, then you want to bring the child to see the doctor sooner, because the higher the fever, it tells us that either the infection load is high or it could be a bacterial infection that needs to be evaluated sooner than later. So the height of the fever and the age of the child is what we really look at, and what your child is doing when they have the fever. So that's the reason why it's important to know how high your fever is and not to worry about the number by itself, but to look at your whole child.
Okay, so what exactly are the symptoms? Like,
when children have a fever, most times, if they're older, they'll tell you, I have a headache. Headache and fever goes together. It's like wet and water. So most times when there's a headache, that follows fever. Sometimes children might have generalized achiness, or they might just want to sleep and not move. They might not want to eat, but all those are symptoms that follow fever. And that also tells us that there's an infection that the child is fighting. But fever by itself, with no other symptoms, is something that you want to treat, but you want to also pay attention to other symptoms as they develop, because it will be the first sign that there's an infection in the child, and that needs to be addressed.
So what of fever in children that actually like goes away less than 24 hours? Is this something you should pay attention to in case if like it should reflect again? Like, what would be the science behind that? That it just fades off like after like a couple of hours, after the child like shivers and then, you know, it's fine again. And it looks like almost nothing happened.
Most times when there's a fever, like I said, you want to treat, but some children will have a fever for 1 day and then they might end up with a rash 2 days later. Oh. But sometimes they might also have a fever now and then the fever goes away after 3 hours, or you give Tylenol or the paracetamol equivalent, or you give ibuprofen and the fever goes away completely, or it goes away and then it comes back. Fever is, I explain to parents that fever goes up, you give medicine, it comes down. 8 hours later, the fever might go up again. It goes up and down, and it can last up to 4 days. Most times when children have fever, if it comes and goes, that's normal. But you want to treat the fever, and then if they have other symptoms that you're worried about as a parent, then you want to bring the child in to be seen by a doctor, preferably a pediatrician.
Oh, okay. But general doctors is fine.
You can see your doctor, your what we call your GP.
General practitioner.
It's important, but have your child checked out, especially if the fever is lasting 4 days, and if your child is very sick. But if your child is looking good and has a fever for 1 or 2 days and then is fine, it might not be necessary to see a pediatrician or to see your doctor. But always keep an eye out when there's a fever, because that's the beginning of other symptoms that could be related to the reason that the child is having the fever in the first place.
So like what, because in Nigeria, we know that once you have a fever as a child, automatically is malaria. Like even without. So what can you do in that instance? Like, do you know that, like, not like prescribing a test now or like that, but diagnosis, like literally like, aside malaria, what other like diseases could be related to like
to fevers?
Exactly. I know there are tons of them, but specific ones in children.
Well, there's certain scenarios where we don't like to see fever in children. if you have a child that is less than 2 years old, that's a red flag, because there are certainly immunocompromised populations that when they have fever, we don't like. If you have a baby and your baby is 1 month or less and they have a fever, irregardless of whether the baby looks good or not, that fever needs to be checked out, because babies are immunocompromised. Less than 6 months.
Immunocompromised, if I want to break it down for...
If your baby is less than 6 months old, their immune system is not well developed, so they cannot fight infections.
Okay.
And thank you for letting me know that. So that means that your baby needs to be evaluated. So babies that are less than a month old with a fever, please take them to see the doctor. If you have children that are less than 2 years old generally, and the fever is lasting 2 or more days and is high, especially if it's more than 102.5 degrees Fahrenheit or 40 degrees centigrade, those are high fevers. Take your baby to see the doctor, especially if they're in diapers, because they might have a urinary tract infection. If you have a child who is a sickler or sickle cell disease, that child doesn't have a good immune system to fight infections. So that's why you want to see the doctor as soon as possible, sooner than later. And if your child has been on cancer chemotherapy, your child is immunocompromised, or your child's immune system is not working well, take them to see the doctor. Most families need to know that once you have a baby that is less than a month old, fever is not a good sign. And if your baby is less than 2 years old and the fever is lasting, especially more than 2 or 3 days and is very high, see the doctor as soon as possible. But if you want to see your doctor as soon as possible for a child who is not within these age groups, but is just looking sick, if you're not comfortable with the way your child looks, go take your baby to see the doctor. And you can go to a GP. The GP will assess the baby and decide what to do next. It's always safer to err on the side of caution than not to. So that's important. So please make sure, if your child has a fever, get a thermometer, check the temperature, and just make sure that your child is evaluated to make sure we're not listed anything that could potentially be a problem for the child.
So it's safe to say that fever is that red flag that should be
monitored.
Should be monitored, in relationship, if you see a red flag, you're supposed to run. But this time around, you're supposed to pay attention to that red flag.
Pay attention.
It's the root of most diseases.
It's the beginning of an illness that could potentially be very deadly if it's not taken care of, especially when the child is less than 2 years old, in diapers, or less than 6 months old. They need to be evaluated.
Makes sense. So you guys, go see your doctor and stop doing over-the-counter medication once you have fever. Not all fever is malaria.
Yes.
Please. It's very, very, very important. So thank you for coming on our show. Until next time. Bye.